First tonight, why one of our health services is begging others for multi-million-pound loans. The NHS in Cambridgeshire and Peterborough is in a financial crisis. It's almost £200 million short of what it needs. The collapse of a major care contract and the fact that it gets less per person in funding than most other health providers here are part of the problem. But the county has now asked 5 of its neighbours for a £5 million bailout. It's also about to start consulting on more cutbacks. So let's get the details now with our political correspondent, Ben Schofield. Ben.
Yeah, thanks, Janine. The headline is really this figure, £192 million. That's the huge funding shortfall facing what's known as Cambridgeshire and Peterborough's Sustainability and Transformation Partnership. That's an NHS umbrella body that includes our big healthcare providers, including our GPs, and the trusts that run hospitals like Addenbrooke's, Papworth and Peterborough City Hospital, among others. In the NHS, it's really the GPs that hold the purse strings. They receive money from the government and decide where it should be spent. They run what are called clinical commissioning groups, or CCGs. Now, Cambridgeshire and Peterborough CCG says it's been historically underfunded and that it's funded less than its neighbours. It gets £1,125 per person. West Suffolk gets £1,288 per person. That's a £163 per person difference, or, as they put it, £150 million per year. They say they're the third lowest funded CCG in the country. There's also a dispute over how big the population in the county is. The Office for National Statistics, which the NHS uses to work out the funding, says by 2021 it'll be 988,000, but Cambridge Research Group, which the CCG is quoting, says it'll be about 30,000 higher. Now it's emerged that the 5 other sustainability and transformation partnerships in the east of England have each agreed to loan Cambridgeshire and Peterborough STP £5 million each to help tackle the shortfall. The CCG, meanwhile, says it wants to save £33 million this year from services delivered outside of hospitals. It's about to launch a big consultation about how exactly they're going to achieve that. I've spent some of today looking at the present and future of our NHS. In Cambridgeshire, world-class healthcare, free for patients when they need it, but in this county, patients worth less than elsewhere.
Well, it's difficult to get a GP appointment. I went to the surgery at 8:30 so that I can get an appointment for yesterday. You know, that's the only way, really. You can't book anymore.
My son's been quite ill, and every time he goes to the doctors, it's, oh, well, we can't get an appointment, you know, we can't book you in, or you're on the phone and it's constant sort of like, you know, you're in a queue, you're in a queue, you're in a queue, and then it's emergency appointments all the time.
With a funding formula they say is unfair, the NHS in Cambridgeshire and Peterborough is no stranger to cuts.
We're going to need an elastopath, you know, we're going to need a chunk of money so that we can continue.
Local Independent MP Heidi Allen now campaigning for more cash.
If you're struggling to start a family, you'll know that IVF is no longer available at all, not even one cycle. Moderate hearing loss now no longer qualifies for hearing aids. But it's also just generally our ability to keep up with growth. It's all very well and good with planning applications, getting capital funding to extend the size of our GP surgeries, for example. But the CCG need revenue funding. They need to pay for those nurses and doctors, and we just don't have that.
Bailouts aside, some doctors say cultural and organisational change is needed.
Our view is that people should be able to access things in the community when they need them. And that
James Morrow runs the Granta medical practice in South Cambridgeshire.
I think the ultimate solution is going to be re-engineering things to take the high-cost, relatively low-benefit services and interventions out of the service and begin to develop lower cost, in some ways less glamorous aspects of healthcare. It's about getting the message across about obesity, about diet, about alcohol, about smoking. If we can address those issues, then in the longer term, we stand a much better chance of not only having a healthier population, but one where we can live within our budget.
For Dr Morrow, preventing long-term illness could help cure the NHS's finances. Now, Cambridgeshire and Peterborough's Clinical Commissioning Group board is due to meet next week, when we're expecting them to launch a big conversation about their financial future. Asked about the £5 million bailout loads from the other NHS bodies in the east of England, Anne Radmore, the Eastern Regional Director for the NHS in this part of the world, said this: "We expect every NHS organisation to live within their means, and the benefit of taking a joined-up regional approach is that we can tackle the issues together." Janine.
Thank you, Ben.